morning, viewer. Welcome to our Glory Globe TV. Here's amazing news for our viewer. New research suggests that one of the most common hospital-acquired infection spreads far more widely in intensive care units than previously recognized, over 3 times more than earlier estimated. Clostridium difficile or C. diff is a highly contagious bacterium that causes diarrhea, abdominal pain, and fever, and can be fatal in about 6% of US cases. Earlier studies indicated that direct transmissions between patients with relatively rare, but by tracking C. diff throughout the hospital environment, not just in patient, researchers uncovered a hidden web of contaminations and transmission. There is a lot going on under the hood that we are just not seeing, says Michael Rubin, MD, PhD, epidemiologist and infectious disease specialist in the Spencer Fox Eccles School of Medicine at the University of Utah and senior author of the study. And if we ignore that, then we are potentially putting patients at unnecessary risks. The results are published April 4 in JAMA Network Open. To track infectious throughout the healthcare setting, the researchers sampled of C. diff from nearly 200 patients across two intensive care units, as well as collecting thousands of samples from hospitals, from surfaces and healthcare providers' hands. The researchers used whole genome DNA sequencing to precisely track bacterial movement. Different bacterial samples have genetic differences, which the researchers measured to track movement of C. diff around healthcare facilities. The team was even able to use these differences to determine if two bacterial samples came from the same patient rather than being acquired independently from a source outside the hospital. The team detected the bacteria in 10% of patient ICU stays, either on the patient's body or in their immediate room environment. And in most of those cases, the bacteria were genetically identical to those found in another patient or another patient's room, suggesting that the bacteria originated from the same patient rather than coming from two different sources. We find out the same amount of patient to patient transmission as previous studies, explained Lindsay Keegan, PhD, Research Associate Professor of Epidemiology at U of U Health and first author on the study. But what we find that's novel is that there is a lot more movement of C. diff between surfaces, from surface to patient and from patient to patient surface than previously found. Beyond the exclusive report, Glory Globe TV, Delhi, Bharat.